is Michelle. I'm going to be your nurse today. Can I just start by getting your name and date of birth?
Mary Smith, 8/22/90.
Perfect. And then I'm just verifying that on your wristband here. Looks correct. And then, Mary, I'm here today just to insert a urinary catheter as prescribed by your doctor. And I did verify his orders. That's what we're going to be doing today. Have you ever had a urinary catheter before?
Yeah, this is nothing new.
Oh, okay. Well, then I don't have to explain that you just insert the tube into the bladder and it's going to help you urinate.
Okay.
Are you in any pain on a scale of 0 to 10?
Nope.
Perfect. And then, do you have any allergies? Any allergies to latex or iodine?
Nope.
Shellfish?
Nope.
Alrighty. Then we'll go ahead and get started. I'm just going to raise the bed up a bit here.
Okay.
That way you're just a little bit closer to me and it's a little bit easier to work, okay?
Okay.
And are you in a comfortable position?
I think so.
Alright. So for the purposes of this video, I am going to uncover you completely, but usually I would maintain your privacy. I do have a blanket here that I am going to drape over you to keep you a little bit warm and just provide the upper body with some privacy, okay?
Oh, thank you.
Absolutely. Alright, and so then I will be pulling this guy down here. Let's see. Let's see there. Alright. And then I will just verify that you have already been cleaned and you're ready for the sterile part of the procedure, okay?
Okay.
I'm going to perform hand hygiene and I'm going to apply my gloves. Perfect. And then I'm going to be putting you into the dorsal recumbent position. That is just going to be lifting your legs up towards your chest and out to the side a bit, okay?
Okay.
That way there's a little bit better access here.
Okay.
Perfect. And then I'm going to grab my supplies over here, bring them a little closer to you. And then this is just going to go underneath you, just in case there's any leaking or anything, okay? I just had you look at your hips for me. Thank you so much. Alrighty. And then my glove's still on. I will remove this from the packaging. Alright. And I would set that there. I'll set my package here. And then I am going to wait just a second. But first I would open the furthest flap, and then these two flaps here, and then the one closest to me, and that is going to create a little sterile field here for me. Just the outside edges. And then this one, I'm going to just grab the 1-inch border here, and on the shiny side, I'm going to stick my hands underneath, and I'll just have you raise up your hips for me, okay?
Okay.
Sorry, wrong way. There we go. Perfect. There we go. Alright. And then not to break my sterile field, I'm going to remove my gloves. Toss them into the garbage can, and then the garbage can a bit closer to me so I can use that. Perform hand hygiene. And then I'm going to remove my sterile gloves here. And I'm going to put those on now. Alright, and then I'm going to remove the drape and place it just over the area we're going to be working with. There we go. Perfect. And then I'm going to remove my sterile tray. Pull my tea out here. Get that ready for me. Set that off to the side here. Perfect. Leave that just for a moment. Alright. Now I'm going to remove my iodine solution. Put my forceps here. And then I would open up my iodine solution. I would cover my cotton balls with it and then discard the package. And then I would also remove my solution here that I will fill the balloon up with. And then I would take my lubricating jelly and open it up and put it in here so that we can lubricate the area. I'm going to set that here just in case I need some more. Alrighty. And then at this point, we are going to take the forceps. I'm going to pull back the urinary meatus. And with my cotton ball, I'm going to go to the outer far side first. Toss that. Go inside closest to me. And then the very center is the last one I will clean from the clitoris to the anus. Alright. And then this hand is contaminated now. I'm going to leave that there to hold it open for me. I'm then going to remove the outer packaging, which is a little bit difficult, but that's okay. Maybe. Kind of stuck on there a little bit. Alright, I'm going to ask just for a little bit of help here to pull this from my assistant, just because we don't need to have that sterile. Perfect, thank you so much.
You're welcome.
Alright, and then I'm just going to lubricate the tip here. Alright, and then Mary, as I insert this catheter, I'm just going to have you bear down. It's going to be just like when you go to take a bowel movement, okay?
Okay.
Alrighty, and then I will ensure that my bag is clamped, and it is. Alright, and then Mary, go ahead and bear down, okay?
Okay.
Here we go. I would wait and see that I have some urine flashback. It looks like I do, and I will go just before I meet the resistance, and I wouldn't go any further than that. Perfect. And then put this over to the side here. Alrighty, we got that in with my non-dominant hand. I'm going to grab this tubing here now. I don't have to be sterile any longer. I'm going to move my bag over to the side a little bit here. Alright, and then at this point I'm going to instill my solution, or sorry, my water, sterile water, into the balloon to inflate it. And that's just going to be right here into this orange little tube here. There we go. Alright, now we want to make sure there was no air in there or anything. And I'm just going to slowly insert the fluid. Perfect. Are you in any pain, Mary? Does that feel okay?
No, I think I'm good. No pain.
Okay. Alright, slowly pushing the liquid into the balloon to inflate it. Alright, and once all the fluid's in, I will remove that, and then we will take our strap here. Oh, sorry, my hands will be covered in iodine solution, so I will not, I'm just going to set that there, down there, and I'm going to remove these gloves so that I can put some clean gloves on. I will perform hand hygiene and put clean gloves on. All right. Now that my clean gloves are on, I'm going to take the strap and find this side here. Under the leg here, and then making sure that there's a little bit of slack left. I'm going to strap it just above the porthole here on the leg. There we go. Hold that steady with that hand. Velcro. Hold that tubing in place right there. Alright, now that that is secured on the leg, there's some slack there. I'm going to take the bag and hang it below the bladder, but not on the edge of the railing, which there's a little clip off to the side over here. Where are you at? There we go. Off to the side, and then I would clip this to the bed sheet so that it stays in place. And then I would begin to clean up my mess. Sorry, that came undone from the Velcro. Alright. That Velcro is not sticking, I apologize. Okay, it's sticking now. So now I'm going to clean up my mess, Mary, okay? Okay. Just take this off. And then I'll cover you up, okay? And then it looks like I do actually have another order to get a urine specimen from you. So I'm going to go ahead and take my forceps here, and I'm going to just clamp right here. And that'll be for 15 minutes. I can't take the specimen from the bag because we do need it to be as clean and sterile as possible. Is that going to be okay with you?
I think so.
Okay. And that is for the doctor's order that I'm reading right here in your chart. So I'm just going to clean up my mess while we're waiting for those 15 minutes, okay?
Okay.
Perfect. And there's your specimen cup. Get rid of all this. Get rid of this. And this. Now so you lift up your hips for me so I can remove that. Come out from under you. Perfect. Thank you so much, Mary. Doing such a good job. Alright. And I'm going to take and throw all of this away into the garbage can. Kind of sitting there. Alright, and then I'm going to take these gloves off. I would cover you up for the remaining of the 15 minutes. There, we'll put your dress down a little bit, gown down a little bit. And And then I'll go ahead and just remove that for now, okay?
Okay.
Alright. And then I put you into the lowered position. Give your call light, make sure that you're comfortable, and then wait for the rest of the minutes. Perform hand hygiene, document what I've done of the insertion of the catheter, and then I'll be back in about 5 more minutes, okay, Mary?
Okay.
Okay.
Hello.
Hi, Mary. I'm back to do your specimen draw from your catheter bag. It's been 15 minutes. Can you just verify again for me your name and date of birth?
Mary Smith, 8/22/90.
Thank you so much. And I'm just going to perform hand hygiene. And I'm going to go ahead and put gloves on here. Are you in any pain? Is that catheter feeling okay?
I think it's okay.
Alrighty. And then, like I said, for the doctor order, we're just going to get a specimen of urine. And we
Okay.
did clamp it for 15 minutes, so it's going to be a clean catch.
Okay.
Okay. And I'm just going to pull your blanket back a little bit here. I'm going to keep it clamped while I withdraw the urine. Make sure this is opened up for me. I would, assistant, could you please bring me an alcohol pad to clean this port? Thank you so much. Alright, so then I would have an alcohol pad. I would clean very thoroughly the port area so that this catch remains as clean as possible and no foreign contaminants. Alright, once I feel like it is clean, I'm going to then add on the syringe. And I would have first withdrawn, get on there. Sorry, after cleaning, then I will withdraw, for a specimen, there we go, 3 millimeters of urine, okay?
Okay.
Alright, got my 3 millimeters there. Alright, and then at that point, I'm just going to unclamp. I'm going to cover you back up. And I'm going to put the 3 milliliters of urine into the specimen cup. I would put the label on it. I would put Mary's name and date of birth. Mary, I just put your name and date of birth on this label here. Can you verify that that's you?
Yep, that's me.
Perfect. I would put it in a biohazard bag and I would send it off immediately to lab.
Okay.
Perfect. And then I am going to just lower your bed here, take off my gloves, throw them away, clean up my mess. I'm going to keep my syringe though because I'm just going to keep my syringe. And then perform hand hygiene. And then Mary, I'll be back to check on you in a little bit. I'm just going to give you your call light here, and if you need anything, let me know. Are you comfortable?
I think so.
Perfect. I'll be back shortly to check on you.
Okay. Everyone.
Hi, Mary. I'm Michelle. I'm back to just check on you, and it actually looks like I have a doctor's order to discontinue your urinary catheter. Can you just verify your name and date of birth for me?
Yeah, it's Mary Smith, 8/22/90.
Perfect, sounds good, and that's what I'm seeing here on your name badge. And then I'm just going to raise the bed up, and then for the removal of the catheter, you said you were familiar with the process of catheters, but you shouldn't feel any pain. There might be a little bit of discomfort, but we'll try to make it go as easy and smooth as possible, okay?
Thank you.
Absolutely. And so I'm just going to perform hand hygiene. I'm going to put my gloves on. Alright, and then I'm going to just pull back your blanket here. I'm for video purposes, I'm going to uncover you all the way so that we can see. Perfect. And then I will drape this over you to keep you covered a little bit and warm, okay?
Okay.
Okay. And then just pull back your gown here. I would remove your catheter strap. Alright. Your strap is removed here. And then I'm going to put you back into the dorsal recumbent position.
Okay.
And then, so I'm going to have you take a deep breath in, and then I'll tell you to release it slowly as I pull the catheter out smoothly and slowly, okay? Give me just a second here. There we go. All right, and then I have my syringe, and then we're just going to remove the fluid from your balloon, okay?
Okay.
All right, and then I would pull back 0.5. Come on. Make it go. There we go. All right, so I'd pull back 0.5 milliliters of air, and then I would attach it here to your balloon. And then let gravity just release the liquid, okay?
Okay.
Slowly but surely. I appreciate your patience.
Of course.
All right, Mary, I had inserted 10 milliliters of fluid into your urinary catheter bag, or balloon, sorry. I do show that I have 10 milliliters of liquid here. And then I'm just going to go ahead and discard that. And then I'm going to have you take in a deep breath. And then bear down and breathe out slowly as I slowly remove it, but smoothly, okay? Very good. Alrighty. And then I'm just going to verify that the tubing is intact. All that I put in is there. I'm going to take the tubing here and I would wrap it up into the bag. And discard of that. I would have drained any urine out of the bag prior to doing so. And I'm going to, I do have a little bit of lubrication on these gloves here. I'm going to remove them, perform hand hygiene. If there was any peri-care or anything needed, I would do so now. But it looks like you were already cleaned up very well by your CNA. So I'm just going to place you back into a regular position. Are you feeling any pain?
No, I think I'm okay. Thank you.
All right, let me get you covered back up. I'll put your blankets back on here. Get rid of this one. You don't need that anymore. All right, and then I would put your bed back into the low position. Mary, are you comfortable?
I think I'm okay.
All right, I'm going to just go ahead and take off these gloves now, perform hand hygiene. I'm going to give you your call light just in case you need anything. I will have cleaned up my area. Throwing away my gloves, and then perform hand hygiene, and I'm going to document the insertion of the catheter as well as the specimen collection as well as the discontinuation of your catheter. Is there anything that I can do for you, Mary?
I think I'm okay. Thank you so much.
All right, wonderful. You have a great day, okay?
You too. Bye-bye.
Thank you.